More than a month before the new Congress meets and 7 weeks before the 2017 presidential inauguration, AIDS activists kicked off a campaign to resist cuts to the healthcare system called for by congressional Republicans and Donald Trump. On December 1st in Washington, D.C., 11 AIDS activists were arrested while staging a sit-in at the office of Speaker of the House Paul Ryan in protest of his and Congressman Tom Price's plans to dismantle the U.S. healthcare system that the global HIV response depends on. People with HIV, nurses, students, and others took over the hallway outside of Ryan's office, holding signs and banners reading, "Ryan and Price's healthcare dream is a nightmare for people with HIV." AIDS activists delivered a letter to Ryan's office and to the office of Congressman Price, who is the incoming Trump administration nominee for Secretary of Health and Human Services. Next, Health Gap member Matt Kavanaugh knocks on Speaker Ryan's office door. Staff members come out of a side entrance to see who's knocking, and the protest begins.
Representative Ryan.
How are you guys?
Oh, hi, how are you?
Hi, it's nice to meet you. I'm Allison.
Allison, hi, I'm Matt. Nice
Good to meet you.
Thanks very much.
This is Patrick.
Patrick, hi, how are you?
Nice to meet you.
We're here because we are people living with HIV, students, activists from across the country who are here to tell Representative Ryan and Representative Price that it is completely unacceptable that here in the nation's capital, the plan right now is to privatize Medicare, to block grant Medicaid, to repeal Obamacare, that people living with HIV depend on. It is a lifeline for people living with HIV in the United States. And meanwhile, the massive cuts to global programming around the world that will come from cutting discretionary spending will mean that we won't be able to expand AIDS programs to reach all the people who need it. We won't be able to reach people in East and Southern Africa who are in dire need of access to antiretroviral treatment. This budget cuts will kill people. The plan right now on the table will absolutely kill people, and that is why we are here to deliver this letter to you and also to give you this clock. The demand is that it's time for Paul Ryan and Tom Price to wake up and stop privatizing our healthcare. We're going to now stay here until Paul Ryan comes over and confirms to us that he will not, in fact, enact the House budget as it was put together. Will Representative Ryan be coming?
As you can see, our office is only taking scheduled appointments today, so we're happy to submit a scheduling request.
Is there a commitment that you will not enact the House budget as proposed?
I'm happy to pass your message.
Paul Ryan, don't you dare privatize our health care! Paul Ryan, don't you dare privatize our health care! Paul Ryan, don't you dare privatize our health care! Paul Ryan, don't you dare privatize our health care! Paul Ryan, don't you dare privatize our health care!
Activists were arrested and taken to Capitol Police headquarters after sitting down and refusing to leave Ryan's office until the Speaker committed to reverse course on budget plans that would be deadly for people living with HIV. At a rally outside of the building, Jason Walker of Vocal New York explained the purpose of the demonstration.
So we are here today as a community, people fighting against the AIDS epidemic, people living with the virus, to demand that Speaker Paul Ryan keep his corporate hands off our healthcare system. We are here to demand that we do not have the privatization of our Medicare system. We are here to demand that we do not repeal the Obamacare. We are here to demand that access to health care is a human right for all Americans. We're here to demand to make sure that people with HIV/AIDS have access to life-saving treatment. It has been over 30 years since the beginning of the AIDS epidemic, and today is World AIDS Day. We have lost hundreds of thousands of our mothers, of our fathers, of our brothers, of our sisters, of our lovers, of our friends to an epidemic. Sons and daughters. Today we say no more. Today we protect and fight what is ours, which is our healthcare system. And we demand that the healthcare system stays in the hands of the American people and not into corporations. Are y'all with me? Yeah. So people with AIDS are under attack. What do we do? People with AIDS are under attack. What do we do?
Asia Russell of HealthGap explains the battle to preserve the healthcare system is winnable.
My name is Asia Russell, and I'm part of HealthGap, an AIDS activist organization fighting for treatment for access worldwide. We're here today on World AIDS Day because we have a demand. We're here for you, Representative Tom Price and House Speaker Paul Ryan. We're here at your doorstep on behalf of more than 35 million people with HIV worldwide, people, half of whom have no access to life-saving HIV treatment. They are our brothers and sisters, they're our friends and our lovers. They live thousands of miles away, and they live right here in our communities here in Washington, D.C. These people, half of whom have no access to life-saving HIV treatment, are waiting in line to die without access to medicine that can completely prevent deaths from HIV. Instead of our politicians responding to this moral catastrophe, they are threatening to break the lifeline of Medicare, Medicaid, of PEPFAR, the President's Emergency Plan for AIDS Relief, which provides treatment for 1 in 4 people with HIV worldwide. Representative Price, who's going to be the new Health and Human Services Secretary, the man in charge of health care under President Donald Trump, and House Speaker Paul Ryan, the most powerful man in that building, are standing in the way of life-saving prevention and treatment for our brothers and sisters. And today, we say no. Shame on the deadly, dangerous proposals of House Speaker Paul Ryan and Representative Price. Shame. We won't accept their morally corrupt and cruel budget and what it will mean for our brothers and sisters around the world. We say no.
No!
No! Today, we know why they're putting forward this cruel, despicable budget. They don't need to. They don't have to balance the budget the way they pretend to. We know why they're doing it. They're seeking a budget that would make the deepest tax cuts for the wealthiest people. By what? By starving our health care, by starving people with HIV and people at greatest risk of infection of what is their essential right to medicine, to condoms, to education, to PrEP. And it doesn't matter whether you live in Kampala, Uganda, or you live right here in Washington, D.C. Tom Price, Paul Ryan, they work for us. But they want to deliver a killer budget that would put their corporate cronies and their profits ahead of the lives of our brothers and sisters. And that is unacceptable. We say no. No! We will not go back to the days when the administration wouldn't speak the word HIV, when our Congress refused to pay for housing, for medicine, for condoms, refused to accept the evidence and the human rights that we deserve. We will not be turned back. Not today, not tomorrow, not one day in this new administration. Because the truth is, Representative Paul Ryan and the incoming HHS Secretary, Tom Price, they don't work for their corporate buddies they golf with and they dine at country clubs with. They work for us! And we have to hold them accountable. Why? Because millions and millions of lives are on the line. This is not a joke. The reality is we have the power to stop this deadly 2017 House budget. We are here today because on World AIDS Day, we know we can turn these politicians around. Not because they're gonna see the light, but because they're gonna feel the heat. That's right. This is what is morally correct. This is what financially makes sense. And we have an obligation to stand up today and every single day until this evil budget, this deadly budget, gets put in the trash can of history where it belongs, and until we're sure that the President's emergency plan for AIDS relief, which is the lifeline for people with HIV worldwide, Medicaid and Medicare, the lifeline for people with HIV in their communities here in the United States, are not just protected, they're expanded. Because frankly, I'm tired of begging for crumbs. These programs are an infinitesimal amount of funding compared with the vast wealth of this country and the vast wealth of the billionaires that are about to come in and take over policy making for people with HIV in this country. So they can do this and they must do this. And we're here today to demand full funding for PEPFAR, not just flatlining, but the increase it deserves, $500 million in this budget and $500 million beyond. And we need to ensure that Medicaid and Medicare are not eviscerated and are not destroyed, but are protected, defended, and expanded so that all low-income people, all people with HIV, no matter who they are, our queer brothers and sisters, our undocumented colleagues, everyone in the United States, and all people waiting in line for treatment have access to the science, to the prevention, to the information that will ensure they live long, healthy lives. Just like Donald Trump would want for his family, we demand for our communities. When people with AIDS are under attack, what do we do? When women with AIDS are under attack, what do we do?
Next, a speaker from the union, National Nurses United.
The agenda that Paul Ryan and other Republican leaders have announced for the new administration will destroy health care access for millions of people, not only in the United States, but across the world. The United States has been a leader in fighting the global AIDS crisis. If the new Republican Congress succeeds in slashing funding to global health programs, the result will be deadly. We stand in solidarity with nurses and their patients in countries across the world who require support from the U.S. government for HIV treatment, care, and services. As a nurse who treats patients at the bedside here in the United States, I see every day the importance of programs like Medicaid and Medicare, which millions of Americans rely on to access quality healthcare services. Without these programs, people living with HIV and so many other patients will not be able to access quality health care. They would not be able to afford regular doctor's checkups, necessary testing, or medication that can save their lives. Instead of destroying Medicaid and Medicare, Congress needs to expand and improve these programs. As a nurse, we know that the solution to the healthcare crisis in this country does not include privatizing healthcare further and feeding the pockets of the insurance and pharmaceutical companies. Instead, we need systems that provide Medicare for all patients, including all people living with HIV. People living with HIV across the country and across the world have fought and won incredible advancements in the treatment, care, and services they need. As nurses, we stand by you to defend these programs and to fight for a more equal and just healthcare system for all. Thank you.
This is John Riley for Out FM.